over a decade ago, a doctor gave me a medical diagnosis that changed my life. The news was unexpected and completely blindsided me. For a few minutes, I even felt outside my own body. Maybe you can relate to the feeling. It was the hardest day of my life. But you know what I remember most vividly about that day? It wasn't the doctor or the way they delivered the news or even what I was wearing. No. It was the beige. Beige walls, beige flooring, beige furniture. Beige on beige with a highlight of more beige. The room was cold, dark, sterile, and offered no spatial comfort in that challenging moment. I mean, have you ever met anyone whose favorite color is beige? I just kept thinking, I don't want to be here. And it could have been so much better. There could have been views out to beautiful green space, more common colors on the walls, access to fresh air even. All of that would have helped, not with the difficulty of the news, but perhaps offered a bit more calmness in that challenging moment. Over a decade later now, I've forgiven beige, but that moment has stayed with me. It's had a lasting impact. I'm now an architect who has dedicated her career to mental and behavioral healthcare architecture. I design recovery spaces for people who are struggling with severe mental health challenges, for people and their families who are often in crisis and sometimes having one of the hardest days of their lives. And I often think back to my own experience to help guide me. So I would like to share with you what I've come to believe. How space is designed has the power to be empathetic and kind, the power to comfort and heal, or not. Whether we realize it or not, every aspect of our built environment has an impact on our mood and our emotions. Consciously and unconsciously, our mental health is constantly impacted by the physical spaces we live in. And while I've spent much of my professional career trying to make our healthcare spaces better, I believe it is time we rethink our communities and our cities through this lens. Mental health design belongs everywhere. We all have both physical and mental health. Yet think of all the gyms, the parks, the playgrounds, the YMCAs that we infuse into our cities to help us actively invest in our physical health. Why couldn't we make the same investment in the built environment to help nourish our collective mental health? Think of all the busy airports, the shopping centers, the grocery stores. They're loud and socially dense and overwhelming. Now imagine if these places had areas that people could step into to de-stress and self-regulate. What if we had mental health management spaces in every workplace to help us cope with the pressures of deadlines and other work-related stressors? And the schools where our children learn each day, are those optimized for mental health in their current state? And our libraries and community centers, mental health design belongs everywhere. These spaces and resources would help everyone. And they'd also help those living with a diagnosable mental health illness. The data makes clear that 1 in 4 adults is currently living with a diagnosable mental health illness. And around 20% of children are living with a probable mental health disorder. And if we expand the definition of mental health slightly, we can consider that around 70% of the adults in the United States have experienced at least one traumatic event in their lifetime, which can significantly impact mental health. Mental health concerns are also elevated in communities for individuals from lower socioeconomic communities. Uncertainty around housing, income, safety, these concerns are elevated in these communities, which can have an adverse effect on mental health. So when we think about mental health design everywhere, it's important that we prioritize communities where these strategies would have the greatest impact. It's also worth noting that mental health is a spectrum, and we're all constantly moving along at different stages of our lives. We all have to manage it, the ups, the downs. Whether that's in an inpatient setting, managing it at a workplace, at home, or in public. And with a significant portion of our population having a diagnosable mental health illness, we can't just reserve mental health design strategies for healthcare spaces. We must deploy them to rethink our communities and our cities. Over the last decade of designing mental health care facilities, more than 40 projects in 20 different states, I've identified some very important and broadly applicable design principles that truly make a difference in people's mental health. These design principles can help us think about how these design principles can help inform how we think about all different kinds of spaces, not just healthcare spaces. And they can help inform all of us on how to be more intentional about where and how we spend our time. These design principles are designing for the senses, designing to support psychological safety, and embedding freedom of choice. Let's walk through them, shall we? This is an image that I often put up during design presentations without any context. And I ask, what kind of space do you think this is? I sometimes get things like wellness suite or tech office, boutique hotel even. It almost always surprises people when I share that this is a core space at the University of Kansas Health System Strawberry Hill campus, an inpatient mental health facility in downtown Kansas City. This is a space that was designed to stimulate the senses. This is a space that was designed to stimulate the senses. Did you know that we actually have 8 and not 5, like you might have been taught at school? The other 3 have some fairly complicated names, but are essentially all internal to us and have to do with movement, where your body is in space, and bodily function cues, like knowing when to go to the bathroom, or the one we all try to avoid, feeling hangry. And this is important because it means we all have a different sensory profile and respond differently to inputs. This space is designed to stimulate the senses, sight, smell, sounds, touch, and other sensory inputs to help mental health patients on their recovery journey. This building also has remarkable access to daylight and nature, which is so important because as humans, we spend around 90% of our time inside. So we must do more to bring the outside in and create new opportunities to do inside things outside through design. Views of the city skyline beyond and the Missouri River below are maximized for both patients and staff from multiple vantage points throughout the facility. There are calming colors on the walls, tactile materials throughout, large open spaces for fluid movement, choice of orientation within rooms, and of course, not so much beige. Let's talk about the second design principle to support mental health, designing for psychological safety. In our studio, we often say that a wall doesn't need to be just a flat surface. We can use it to create occupiable spaces along the periphery of a room. So someone would say social anxiety can still feel engaged in what's happening without being fully immersed in the center of the space. This is a strategy we've deployed at several children's hospitals throughout California, and you can see how this brings moments of safety and support and joy for these kids in these care spaces in new ways. We can bring great creativity into these spaces, allowing someone to sit fully supported with their back against the wall in a comforting niche or an alcove, a protected place that's appealing to any child, really, but especially those that may have experienced any past trauma. Designing to support psychological safety also means providing clear wayfinding, so all users, patients, staff, visitors, can effectively find their way through space without any added stressors or anxiety. And the third principle, embedding freedom of choice. It's important in inpatient settings to give people agency whenever possible so they don't feel confined or stuck. We can do this through big moves like space types and adjacencies, or smaller moves like movable furniture and controllable lighting. At Prisma Health Behavioral Health Hospital, there are a variety of different kinds of activity and therapy spaces on unit that someone can choose. And we've located a fresh air porch directly across from the staff desk, so all users, staff, patients, visitors, say caregiver or family member, can step out and get some fresh air while they're here, listen to the sound of the rain or the birds without having to ask for permission. It's a simple yet impactful choice. At Sheppard Pratt's Washington Baltimore campus, the building is purposely embedded in the landscape with porches, passive and active courtyards, landscaped walkways, and other opportunities that empower patients with choice on how they visually and physically engage with the surrounding landscape without sacrificing their desired privacy or safety. This level of choice is actually quite remarkable when you think of the design of mental health facilities from decades past. So I've established the 3 design principles that truly make a difference in people's mental health. Let's use them to imagine how they can reshape our communities. We could start at those busy public places like airports, or grocery stores, or shopping centers by infusing mental health recharge areas equipped with resources to help people ground their senses in ways that are unique to their own sensory profile. And the schools where our children learn each day, let's rethink them entirely. We don't need kids sitting straight ahead all day when they learn best through play. We can create active learning spaces that stimulate the senses and encourage play and movement. Known tools to help reduce stress and anxiety and improve self-regulation. And the corridors, the echoes, the flickering lights, the banging of metal lockers. Let's break them down or do away with them altogether. I recently met a student in high school who couldn't change classes with all of our other peers because of how triggering she found the experience of moving through the corridor. We can do better. We can bring more joy, more calm, and more wonder into our children's schools. College lecture halls, or anywhere with theater-style seating really, even like the space we're in tonight, can be incredibly re-triggering for anyone that's experienced past trauma. You can't see behind you. People you don't know might accidentally brush your hair or your shoulders as they're moving to and from their seats. Take a minute to reflect on how you felt when you were taking your seat tonight. How did you feel? Let's bring more choice into these spaces and ensure greater psychological safety with more varied seating, places where occupants can see larger swaths of the room at any given time, seats immediately up against a wall to feel supported, all to ensure that being triggered isn't just part of going to class or attending an event. And one more example, our libraries. Our community libraries could double as spaces that support both our physical and mental health. Grab a book, attend a yoga class, spend some time in an area that's attuned to help reduce stress. At a time when loneliness has officially been declared an epidemic in our country, our community libraries can do so much more to help support our collective mental health if we infuse them with opportunities for real human connection, socialization, and well-being. So I've shared with you the design principles that truly impact people's mental health. But I want to share with you a bonus principle before I finish up that's very important to me. And that is stigma reduction through location and access. Where we locate mental health care facilities makes an impact. Choosing to locate them outside of or in the hearts of cities makes a statement. Historically, mental health care facilities have been located far from city centers, hard to get to, disconnected from society. Today, we are locating them in the hearts of cities, embedded in neighborhoods, increasing access for all, and inviting everyone in, because we all have mental health. We're infusing them with meeting rooms, pools, parks, playfields, and other amenities that community members can use at certain times. And that helps reduce stigma. Locating them in communal areas, infusing them with resources, now we're blurring the boundary between healthcare and community. We're overtly saying mental health is part of all our journeys. It's not something to fear or stigmatize. Everything I just talked about is doable. We just need to decide that mental health design belongs everywhere and is for everyone. What is good for one of us is good for all of us. That's how we create a much better built world for ourselves and our future generations. I reflect on that challenging moment from more than a decade ago, and while I have forgiven Beige, I promise, I do wish it had been very different. I wish there was a window overlooking a beautiful garden, a rocking chair that faced that window, dimmable lighting, the option to even turn on some calming music. What about you? What would make space better for your mental health on one of your hardest days? How would it make you feel? What would you change to get it? We all have agency to create a world where mental health design is everywhere. We can design these types of spaces. We can advocate for them in our communities. We can choose to intentionally put ourselves in them more often. And we can support mental health care facilities in our own neighborhoods. Together, we can reimagine the built environment to not just be better and brighter, but to nourish our collective mental health at every moment of our lives, because we're all worth it. Thank you.